Hello, everyone. I'm Candace Mahelko, and I want to welcome you to Arrow's quarterly Women's Health Talk. For those of you who might be joining us for the first time, Arrow has collaborated with the Ludeman Family Center for Women's Health Research located at the University of Colorado Anschutz Medical Center for the past 5 years. And scientists affiliated with the center present quarterly talks to Arrow employees on a variety of health topics. So we're lucky today to have Dr. Mary Whipple, who is the assistant professor at the University of Minnesota School of Nursing. She joins us recently completed her postdoctoral fellowship in the Division of General Internal Medicine at the University of Colorado Anschutz Medical Center. She is a registered nurse and received her PhD in nursing and gerontology from the University of Minnesota in 2019. Dr. Whipple's research focuses on understanding the effects of sedentary behavior on cardiovascular health among older adults, with a particular focus on individuals with type 2 diabetes and peripheral artery disease. So with that, I'd like to turn the call over to Dr. Whipple.
All right, are my slides showing up okay?
Yeah.
Great, okay. Well, thank you very much, Candace. Thank you all very much for attending this session. This is a topic that I'm really passionate about, and so it's fun to have the opportunity to share a little bit about it with you. I appreciate the invitation from Arrow Electronics and the Ludeman Center for the invitation to present. And today I'm going to share a little bit about sedentary behavior, which some have likened to being the new smoking. We all know that smoking is bad for our health, but I'm going to talk today about what it means to be sedentary, how that can impact our health, and whether sitting may be as important as a health risk as smoking is. So before diving into my research itself, I wanted to just take a moment and share a little bit of my background, as I know folks are often interested on how someone comes to a career in clinical research and how a nurse ends up with a PhD. So I received a Bachelor of Arts in Biology and Psychology from Luther College, a small liberal arts school in Decorah, Iowa. And during college, I knew that I was interested in healthcare and science, but I wasn't really sure what form those interests would take. So after graduation, I started working at Mayo Clinic in Rochester, Minnesota, in the fibromyalgia and chronic fatigue clinic, where they treat patients with chronic pain and chronic fatigue. I was their first research coordinator in that program, and it was really an opportunity to learn how to do research on the ground, to understand how important it is and how we really get patients and participants involved from research, from conceiving of the idea all the way through disseminating and sharing those results. So although I enjoyed research in that process, I realized I was missing a clinical perspective and being able to provide recommendations and clinical guidance. So at that point, I went to the University of Minnesota and received my Bachelor of Science in Nursing and became a registered nurse. From my BSN, I went right into the PhD program. I knew I wanted to do research as a nurse and finished my PhD at the University of Minnesota in 2019. I have a minor in gerontology, which is a study of aging. So my work really focuses on older adults and how we can work with older adults to help improve health. Once I finished my PhD, I moved to the University of Colorado and had the great pleasure of working with Dr. Judy Regensteiner in the Division of General Internal Medicine and the Ludeman Center, doing research in sedentary behavior in older women with type 2 diabetes. I was there for about 2.5 years, and just this past January, moved back to my home state of Minnesota and am an assistant professor here in the School of Nursing, where I got my PhD. So I'm really glad to be back and be able to kind of continue to work with and collaborate with the Ludeman Center and the scientists that I met while at the University of Colorado. The reason I do this research is really because of my grandmother. She's the reason that I focus on older adults with type 2 diabetes and the reason that I'm really interested in sedentary behavior. My grandmother was someone who was a huge influence in my life. She had been divorced since she had really young children, and so divorced all of my life, and has lived independently for 40-some years. She was the woman that was stubborn, one of the most stubborn people I know, but she had uncontrolled type 2 diabetes, was not physically active, and had a lot of atherosclerosis and cardiovascular disease as well. And when she fell in her home, and broke her ankle, that changed the course of her life and the life of all of my family members. She lived in a nursing home for the last 2 years of her life and was never really able to walk again. And so she's the reason that I focus on this population and on this area of research. And I really hope to honor her memory through the work that I do. And so let me share with you what that work is. So I want to start by talking about a few key definitions. First, you've probably all heard people talk about both physical activity and exercise. Although they're often used interchangeably, there is a difference. While all exercise is physical activity, not all physical activity is exercise. So physical activity, or PA, refers to any movement of the body that requires energy. Exercise is the special type of physical activity that's planned, it's structured, it's purposeful, it's really done with the intention of trying to increase fitness. So when I'm walking to my kitchen or running errands, that's physical activity, but it's not necessarily exercise. So we all know that exercise is good for us. Might it be in a gym or a community setting, walking, biking. There's a great deal of evidence to show us that physical activity, specifically this moderate to vigorous physical activity, is good for our health. The Physical Activity Guidelines for Americans, which was first published back in 2008, summarizes the evidence and gives us recommendations about what we should be doing. In fact, Dr. Judy Regensteiner and Dr. Wendy Court, who are both associated with the Ludeman Center, the director and the associate director, respectively, were on that original guidelines committee. And the guidelines are that as adults, we get 150 minutes of moderate intensity aerobic activity 3 days a week, over the course of a week. That's usually split up, saying 30 minutes, 5 days a week. We also should be doing some muscle strengthening activity. So using our muscles, doing body weight exercises, and doing some flexibility training. So moderate exercise, you might ask kind of how you know if it's moderate exercise or vigorous exercise. Moderate exercise is exercise that causes your heart rate to increase and causes you to breathe a bit heavier, but you can still talk, but you can't sing. If you're doing vigorous exercise, that's where you can only say a few words. You can't really get out a full sentence without taking a breath. So we know that lack of physical activity is associated with poor health. Physical inactivity, which means not meeting those physical activity guidelines, is estimated to be responsible for about 9% of premature death worldwide. And if we engage in regular physical activity, we can decrease our risk of heart disease, of high blood pressure, diabetes, cancer, and lots of other conditions. So that's the importance of exercise and physical activity. So now I'm going to throw a new term at you, and this is the concept of sedentary behavior. Sedentary behavior is just beginning to gain traction in the field, and it's really becoming a really rapidly growing area of research. So what is sedentary behavior anyway? Well, sedentary behavior, which we abbreviate in this presentation and throughout as SB, is any activity that's conducted while you are awake, using a small amount of energy, and is done when we're sitting or reclining or lying down. So it doesn't include sleeping, but it includes things like when we're commuting or screen time. All of those things are considered sedentary behavior. Sedentary behavior, as I mentioned, is not sleeping. And importantly, it's very different from physical inactivity. So physical inactivity is not meeting those physical activity guidelines that we just talked about. So it's not getting that 150 minutes of moderate activity each week. We often think that sedentary behavior and physical inactivity are the same thing, but you can be both physically active, so achieve those exercise guidelines, and be highly sedentary. So for example, I exercise every day, typically through some high intensity intervals and walking and running. So I achieve exercise or physical activity guidelines, but I also spend a lot of my day sitting at work. The standing desk helps with that, but I spend a lot of my day sitting at work. And so I'm highly sedentary, as are many of us. And research is showing that these two things, physical inactivity and sedentary behavior, have unique impacts on health. So sedentary behavior is important because it's really ubiquitous. It's our default activity. If we're not doing something, we're usually sitting. And so we as a population are quite sedentary. Americans average about 9 to 10 hours per day sedentary. And those with chronic conditions like type 2 diabetes tend to be even more sedentary, as do older adults. And so, as I mentioned, high levels of sedentary behavior are associated with their own unique health risks. For example, if you sit for long periods of time, you're more likely to develop type 2 diabetes, cardiovascular disease, all-cause, and cardiovascular mortality. And you might wonder why this is. Why does it matter if we're sitting versus standing? Well, it's thought that when you're sitting or lying down, blood flow slows down and our calf muscles aren't actively pushing back blood up to our heart. And over time, this can make it easier for fat and plaque to build up and cause heart disease. Also, the risk of developing a clot in the veins can increase. You might have heard about doing, calf exercises if you're on a long flight or spending a long time in the car to help move that blood around. And it's important to know about these negative effects of sedentary behavior because they occur even among people that achieve exercise guidelines. And so it's something that we need to consider. It's yet another thing that we should think about in living a healthy, active lifestyle. And so it's really interesting. This is one of my favorite figures in describing why sedentary behavior and physical activity are both important. This figure originally came from a meta-analysis by Eklund and colleagues that summarizes data from over 1 million adults. And it was included in the physical activity guidelines in 2018 when they were updated. And so on the x-axis here, on the horizontal axis, you'll see moderate to vigorous physical activity. So that's that physical activity that helps us meet exercise guidelines or physical activity guidelines. And on the y-axis, you'll see daily sitting time. And what's really interesting is that the color represents the risk of death, with red being the highest risk and green being the lowest risk. So it shows that if someone is highly sedentary, if you spend a great proportion of your day sitting, it takes a very large amount of physical activity to offset that risk of death. As opposed to if you sit very little, it takes a lot less physical activity to offset that risk. So this is why it matters that we not only encourage people and support people in achieving those physical activity guidelines, but we also need to help people be less sedentary because it matters what we're doing in our other waking hours. If you think about a 24-hour day, if you meet physical activity guidelines, that's on average 30 minutes of moderate to vigorous activity 5 days a week. So what are you doing during those other 23.5 hours? Even if you say you're getting 8 hours of sleep, which might be a little bit of a generous estimate for some folks, there's still a large proportion of our day that is unaccounted for and that we could be spending sitting. So the recognition that sedentary behavior is an important and unique health risk has really developed over the past 10 to 15 years or so. It's a pretty new field, but rapidly emerging. So this is just a visual example of how fast this area of research has grown. This bar graph shows the number of publications in scientific journals by year that include the key phrase sedentary behavior. And so you can see that there's really no research on sedentary behavior until about 10 to 15 years ago, and then it rapidly increases. And now this field has grown so much that there are 18 to 1900 new papers published each year that include sedentary behavior as a key term. So you might ask, one of the things we are interested in is what does the public know about sedentary behavior? What is the messaging that's out there? And this has led to some, this increased attention by scientists has led to some discussion of sedentary behavior in the media. These are some examples of some public messages you might have seen related to sedentary behavior. Some schools are starting to move towards standing desks for students and workplaces as well. I'm thankful to have a standing desk here at my work. And some of us may have worked towards this during COVID and working at home. We might have invested in something similar. It's really common for activity trackers like Fitbit, Apple Watches, Garmin's, and others to include a stand alert that'll kind of prompt you every hour or after a certain period of inactivity to get up and move around for a minute or 250 steps. There's also been several public health campaigns, such as this Get Out of Your Chair ad by the Union of European Football Associations. It's kind of a fun one of showing people sitting in a recliner playing football. And also this idea of really this couch potato. But there's starting to be more and more messaging around sedentary Um, but we don't really know what the public knows about sedentary behavior, about its health effects, and how we really go about changing it. There's been some research on this topic, which indicates that most people don't really know how the effects of sedentary behavior might be different from lack of exercise. And some things, we know that some things that support people in changing are, desire to improve health, knowledge, new awareness of sedentary behavior, just kind of having some education about what the health risks of it are and how we can change that. How easy it is to incorporate those changes into your lifestyle. Right? If you have a standing desk or other strategies that make it easy to stand up more often, you're more likely to do it. And then also reminders, those watches that buzz or ding to let you know that you should stand up. But there are some barriers to standing more. Health conditions. That's particularly interesting to me as I work primarily with older adults. And often sedentary time is seen as a time of rest, of recuperation. And so health conditions can kind of get in the way of sitting less. We also enjoy a lot of sedentary activities, right? Social interactions, reading, watching television, we're doing something on our phone, meals. A lot of the enjoyable activities tend to be sedentary. And so it's a balance of trying to figure out not removing that social activity that's beneficial, but doing it while moving around, while standing instead of sitting. Fatigue is another one. People are tired, and sitting is a way to, like I said, kind of rest and recover. And then also another issue is differentiating, reducing sedentary time from increasing moderate to vigorous physical activity. And that comes in where this knowledge plays in, right? What is the difference between sedentary behavior and MVPA and activity? And so really helping people understand that light activity, just standing up, moving around a little bit, but not exercise, can be beneficial for our health. So that's what we know. What don't we know? We know that being too sedentary, especially when it's combined with low levels of physical activity, is bad for our health. We know about some of the barriers, but we don't know how sedentary behavior is related to the risk of heart and metabolic disease in older adults with type 2 diabetes, specifically older women who are living in the community. A lot of this work, as with a lot of clinical research historically, has focused on young, healthy adults, frequently college-age men. And a lot of this work has focused on really tightly controlled lab conditions, in a very controlled setting, what works to change sedentary behavior. But we don't know a lot less about how we change that behavior out in the world, right? In the setting with, real world pressures and opportunities. We also don't know how knowledge and attitudes towards sedentary behavior might have shifted within this increasing media coverage and the inclusion of sedentary behavior in the 2018 physical activity guidelines. So those updated guidelines that I mentioned, those are the first that have been talked about sedentary behavior and included some recommendations. However, we don't know how much sitting is too much. That's an area there's a lot of research going on in that right now, trying to understand what is the dose of sedentary behavior that's okay. But we don't really know how those attitudes might have shifted. We also don't know how mood or meaning or purpose in life might influence sedentary behavior. You might think that, if someone is feeling down or depressed or anxious, that might influence their behavior. And understanding that could help us think of how we can modify sedentary behavior. And we also don't know how we can support older adults in reducing their sedentary behavior, ultimately with the goal of improving cardiovascular health. A lot of this work has focused on younger individuals, but older individuals might have the most to gain. Physical activity is often can be seen as burdensome or intimidating to some older adults with chronic conditions, and we might be able to use reducing sedentary behavior as a stepping stone toward becoming more active. So that brings me to the study that we're currently conducting at the University of Colorado. And this study was funded in part, is funded in part by a grant that we received from the Ludeman Center. And so the SITWISE study, as we call it, focuses on how sedentary behavior is related to cardiovascular health in older women with type 2 diabetes. So in this project, we're assessing knowledge and attitudes towards sedentary behavior. We're actually measuring sedentary behavior, and I'll share with you how we're doing that in a second. And we're trying to understand how sedentary behavior and cardiovascular health and how well our body uses insulin and glucose are related. And this study is specifically in women because most of the research has focused on older men. But the goal is to ultimately look at both men and women and understand if there are differences in these relationships. So I mentioned we're going to ask about knowledge of sedentary behavior. So the way that we're going to do that is through these in-depth interviews. We're doing qualitative interviews where we sit down with participants, either in person or via Zoom, and talk about sedentary behavior, ask about their perspective. So we want to know, what does being sedentary mean to you? How do you feel when you sit for long periods of time? What benefits or negative effects do you see to sitting? And then also, what have you heard from the media? And then what would help you spend less time sitting? How could we, if we were going to design a program to try to help you sit less, how would you suggest we do it? What would you like to see? I've had participants talk about these activity monitors on their wrists. And one woman mentioned to me she's gotten really good at ignoring it. The monitor works and she notices it, but she's gotten really good at ignoring it. And so what are better strategies that we can come up with to make a difference? We're also looking at mood and meaning. And the way that we're doing that is we're actually sending people text message surveys multiple times in the course of the day to understand at this moment in time, how do you feel? How tired or awake do you feel? How agitated or calm do you feel? And how connected to meaning, do you feel? There's been research that has shown that folks that feel that their meaning is more kind of present in their life, they feel aware of their meaning or purpose, actually engage in more physical activity. And so we want to see, is there a similar relationship in sedentary behavior? Because that could, again, be something that we could work with people to talk about, to help them develop that sense of meaning as kind of a tool toward helping people become more active and less sedentary. We're also measuring sedentary behavior and physical activity. And the way we do this is through a couple devices. So there are a couple different ways to do this. You can measure these behaviors from a questionnaire where we ask you questions about how much time do you spend sitting and you fill it out. And those questionnaires are not particularly good, frankly, in sedentary behavior. As I mentioned, it's a default activity. It's what we do when we're just kind of sitting and what we do when we're not doing something else. And so we as humans just are pretty bad at estimating that. And so the way we're measuring sedentary behavior is more robust. It's a much better method. And so we're using an activity monitor that people wear around their waist. And this gives us a sense of light, moderate, and vigorous activity. So it looks at kind of acceleration in 3 different directions, and we can get counts from that to estimate physical activity. We're also using this in combination with a sedentary behavior monitor. And this is a monitor that's actually stuck on the front of the thigh with a piece of tegader, with a piece of a bandage kind of over top that's sticking it on the front of the thigh. And this is unique because given its position on the thigh, it can tell us about postural change. It can tell us whether your leg is horizontal or vertical. And so we can actually get a much better estimate of sitting, standing, and stepping. And so this is the gold standard for measuring sedentary behavior. So we're using those monitors in conjunction with those other questions to try to understand at that moment in time, how sedentary are people, how active are people, and what is their mood, their sense of meaning in life. We're also really interested in understanding cardiovascular and metabolic risk. And so we're doing things like a maximal exercise test, where we ask people to wear a mask that's hooked up to some tubing that can analyze oxygen consumption and CO2 production. And so we can look at your cardiorespiratory fitness, or how well your body uses that oxygen. This cardiorespiratory fitness is one of the strongest indicators of risk of mortality. It's a really good predictor of kind of your overall health, or a good estimate of your overall health. And so we're using that in this study. We're also looking at how well your muscle itself uses oxygen. So this exercise test is really about whole body, and this skeletal muscle microvascular function really just looks at a much more minute level. How well is your muscles exchanging oxygen? And then we're also doing some estimates of insulin sensitivity, or how well the body uses insulin and glucose. because that can be, that is definitely related to sedentary behavior and physical activity. And we want to see how it's related in this population of older adults who have been, excuse me, much less studied and much less understood. So some of the next steps. So in our work, we're continuing to complete this project, and we started on the next step here of developing a study designed to examine the effects of breaking up sedentary behavior on vascular health among older adults with type 2 diabetes. So not only does the total volume of time we spend sitting seem to matter, but also how much time we spend in prolonged sedentary behavior. Is it a big block, or is it broken up throughout the course of the day? And that breaking it up throughout the course of the day seems to have health benefits. And so we're going to be doing a study, a really highly controlled study in the lab, where we ask folks to sit for 6 hours, to do one bout of exercise and then sit for about 5.5 hours, or to break up that 6 hours of sitting with individual short bouts of walking, and look at how that affects their blood pressure, look at how that affects their vessels, their blood vessels' ability to dilate and contract, and see how that could maybe be a useful tool in improving vascular health in older adults. We're also working to understand how to design interventions that target sedentary behavior among older adults in general, and looking at gender differences in preferences. We're working right now on developing a questionnaire to try to understand, how do we assess somebody's confidence that they can change their sedentary behavior? Because we know that this idea of self-efficacy, or your ability, your confidence in changing your behavior, in doing what you set out to do, we know that that's important in exercise, but we don't know how important it is in changing sedentary behavior. So we're working to develop a measure right now to understand that and measure that. And then also, working on increasing knowledge of sedentary behavior on its impact on health among older adults with diabetes and cardiovascular disease. We don't have any quantitative public health guidelines that tell us how much sitting is too much sitting. And so this is really an important piece in being able to kind of spread the word, to share the importance of understanding and looking at both sedentary behavior and physical activity, and how we really need to kind of look at those two targets when we try to increase activity levels and improve health. So bringing you back to kind of the first question I posed, is sitting really the new smoking? Unfortunately, the comparison is not entirely fair. I don't have a concrete answer for you. We cannot equate the negative effects of sitting with the dangers of smoking. We know that smoking has enormous negative health effects and comes with lots of risks. So those risks are not equivalent. However, sitting too much is harmful, and reducing sedentary behavior has shown health benefits in some groups of people. And that evidence is growing every day, that sedentary behavior has some unique health effects. And so we know that that is an important thing to keep in mind as we strive to live healthier lifestyles. So what can you do right now? Where do I need to go from here? Well, a couple of things you can do is strive to meet or even exceed those physical activity guidelines. And as a reminder, that's 150 minutes of moderate or 75 minutes of vigorous aerobic exercise every week. And then also, along with that, strive to achieve 2 days of exercise per week, of muscle strengthening exercise. So body weight exercises or other things that help challenge your muscles and build strength. The other thing you can do is remember to sit less and move more. Challenge yourself to spend less of your day sitting. And you can be creative with that. It might be setting an alarm on your clock or on your watch to remind you to take breaks at work if you kind of got to get in the zone and don't move for a portion of your day. Could be walking while talking on the phone, turning meetings into walking meetings, either with a colleague in person or on the phone. Can you take a walk, especially as the weather gets nicer? Can you take a walk outside on the phone as part of your meeting if you don't have to be in front of a computer sitting down? Also want to think about being less efficient. Which sounds sort of counterintuitive, that I'm suggesting that you don't do your job as efficiently, but think about ways to incorporate little movements. So if you need to, run down to the copy room and then run down to the mail room, maybe you do that a slightly less efficient way. you make an extra trip. That little bit of extra movement that you can build into your day can be something that's really helpful. And also think about how you can be more active, during doing activities that you might be standing doing or kind of waiting around. Could you do squats or pace around while you're cooking? What sorts of ways can you incorporate just little bits of activity into your day so you spend less time sitting? And the good news is that all movement counts. It doesn't have to be done in certain size bouts. It doesn't need to be, if I don't do 10 minutes, that's not worth it. That's not how this works. All movement counts. And so thinking about those little ways to increase your activity and reduce the time you spend sitting would be a great first step. So I just want to take a second in closing to acknowledge the wonderful mentors I've had at the University of Colorado and our study team, and the funding that we've received that's really made it possible to complete this work and to get to these next steps. I really appreciate the opportunity to speak with you today, and I look forward to your comments, and I'm happy to take any questions.
That was wonderful, Dr. Whipple. Let me make sure that I'm seeing here. It looks like we do have at least one question. Let me check it out here. For those that don't know me, I'm the deputy director at the center. I've met some of you when we were doing these as lunch and learn, so it's nice to have you all online. Our first question is, have any studies been completed on how sedentary behavior might relate to migraine headaches?
I don't know the answer to that question. It's not an area that I've spent a lot of time focusing on. We do have studies that have linked sedentary behavior to other diseases of the blood vessels in the brain. So there have been studies that have looked at like mild cognitive impairment and dementia and sedentary behavior as a way to sort of increase reducing sedentary behavior as a way to increase blood flow to the brain. I don't know specifically in migraines though, but I think that's a great area to look into.
Yes, great. And we've actually had some speakers on migraines. Maybe that's a question that we could bring back in another one of these Aero Talks. How important is it to have a variety of movement, if at all?
It's a great question. We know that there are benefits to light physical activity, moderate physical activity, and vigorous physical activity. But we don't know that there are specific doses of each that we should be striving to achieve. I mentioned that understanding how much sitting is too much is an area that's really growing. There's some work going on to try to pull together lots and lots of data from different populations and understand, how much sitting is really detrimental. Is it if you sit more than 6 hours or 8 hours or something like that? There have been a lot of ways that people have tried to break up sitting. So there have been studies that have looked at just light walking. There are studies that have been looking at more vigorous walking or moderate walking, as well as squats, calf raises, other sorts of under desk cycling. We don't know which is best. And I don't think we know yet which is the best. This area is so rapidly growing that we don't yet know which one is the best. We just know that movement matters. So I think the best physical activity that you can do is the one that you will do, right? The idea that something that you enjoy, something you can stick with, something that, if you really hate running, don't go running. The idea is do something you enjoy, something that you can see yourself doing regularly. Otherwise, you're going to get kind of burnt out with it. And if kind of switching up your routine regularly works better for you, you want to try a month of this and a month of that, then that would be the way to go. Because what we're looking at ultimately is the energy that we're burning, not necessarily how we go about burning that energy. The one caveat I'll say to that is that we do know that both aerobic exercise and resistance exercise are important. So you'll notice that the exercise guidelines talk about aerobic exercise, which is where your heart gets beating faster and you start sweating, or maybe aren't able to speak in a full sentence. We know that type of exercise is important, as well as exercise that uses body weight or weight to build muscle. So both of those types are important and are recommended according to the guidelines.
As a follow-up to that, would you foresee with sedentary behavior as the research matures, something that's like try to get 9,000, 10,000 steps, but something similar, or a measure that might relate to sedentary behavior?
Yeah, I hope we can get to that point. That 9,000, 10,000 steps, that a lot of our activity watches and devices are built in to say 10,000 steps is the guideline. And that's based on, it's based on roughly 5 miles and roughly, trying to estimate how much distance someone would cover to achieve those kind of daily guidelines. That number is not a hard and fast rule. We don't have a lot of science that says 10,000 is better than 9,000, or, in terms of health benefits, we just know that more activity is good up to a certain point. There's a kind of a very extreme end where they start to see some differences. But we don't know how much sitting is too much. And I would love to see the point that we can get to a point where we can understand, does it really matter if you get up every hour, or is it more every 2 hours? That alert every hour that's built into watches is not based on evidence. And so it would be great to get to the point where we can better understand how that important that is. An hour is nice because a lot of our days are often built around hours, right? A lot of meetings or other activities that we do. And so it's a natural kind of break. But we don't necessarily know if breaking up every hour is more important than 2 hours. So I hope so. I hope we can get to that point.
It's a similar question, which makes me think about the sitting and yoga, and whether exercise that's standing is the key. So the question is, are there any effective exercises that you can do while you're sitting?
Yeah, there are lots of effective exercises. I have a colleague here at the University of Minnesota that actually does work with individuals who have something called peripheral artery disease, which is a buildup of plaque in the arteries in the legs. And she's found that arm biking, so using your arms on a bike on the pedals, like biking with your legs, is actually pretty effective in improving walking in these folks, which is kind of a surprising thing if you think about using your arms to exercise can improve your walking. So yes, if you prefer recumbent biking or other kinds of activities, those are great. Again, those are getting your heart rate going. And so that's really where we look at that moderate activities, getting your heart rate going. In terms of how doing like a sitting down upper body exercise compares to just sitting, we have a lot less information on. There have been studies that have done where I mentioned breaking up the time you spend sitting. There have been studies that have used an under desk cycle and had people bike while they're sitting as sort of their breaks, and that has shown some benefit. So it's not entirely the standing. The reason the standing seems to be important is when you sit, you're cutting off some of that, you're restricting blood flow to some of those major blood vessels in your legs, right? Instead of being straight up and down, they're at a 90-degree angle. And that's why they think over years, over decades, that becomes a problem.
Okay. Another question is, how much water do you really need each day? And does water intake affect your energy levels?
It's a good question. It is important to drink water. I think I'll defer to the guidelines. And I think the recommendations are 8 cups of water a day, but don't quote me on that. The idea is to drink water. Many of us, as a general rule, don't drink enough water throughout the course of the day. And you can certainly find yourself feeling more tired if you haven't eaten appropriately, if you haven't drank water appropriately. So everything in moderation.
Another question is, can any of the studies mentioned be shared with attendees?
Sure, I'm happy to share the references with you, Jennifer, or whoever, so that folks can reach out or take a look at those themselves. Yep, definitely.
I don't know if we still, at one point we had it on our website too, at ludemancenter.org.
Okay.
We do list most of our studies, clinical studies that people might want to participate in. So that's another source, but we'll get it to Karen and from Dr. Whipple.
Yeah, that'd be great.
I think I might have gotten some in the chat. That was all the questions we had. In the chat, there was, let's see here, hold on. Sitting at my desk during the pandemic has triggered back issues that I personally am experiencing, although I always spend an hour at the end of the day. Must be spending it.
Yeah, and that's, I think that's evidence of why this is one of the reasons why this is so important, right? Is that, folks are still, if you spend an hour at the end of the day engaging in exercise, that's fantastic. But it matters what we do in the rest of our day. And if we spend a lot of time sitting, not only can it have impact on our cardiovascular health, but as you mentioned, our, musculoskeletal health, back pain, from, desk stations or things that don't work with your body, can also be a significant problem. That's why too, if you think about standing more often, you might need I have like a gel pad under my feet here at my desk, because standing for long periods of time can cause back pain as well. So it's also trying to make that work environment, either at home or at work, fit with what you need.
That's a great idea on the gel pad on the standing desk.
Oh yeah,
because,
it's great.
I have one in the kitchen, but having one, if you're standing at, there's another thing to bring it back. So, well, I think that's it that we had for questions. Thank you, Dr. Whipple. If everyone will please answer the survey that you'll receive following this program. We'd love to get your ideas for future programs. And again, we thank you, Dr. Whipple, for the work that you do and for all of you for joining us on this call.
Thank you.